Good afternoon, everyone. Thanks so much for joining us for Good Day PA. I'm Amy Kem. It's the #1 killer in both men and women in the U.S. Do you know what it is? It's actually lung cancer, and it causes more deaths than breast cancer, prostate cancer, and colorectal cancer combined. Dr. Michael Reed and Dr. Jennifer Toth of the Penn State Cancer Institute are here to educate us about lung cancer. They're also sticking around for a web chat that will happen at the top of the hour. Welcome back to the show to both of you. Good to have you. Cancer, it's always a very scary diagnosis for anyone. It sounds like lung cancer is especially scary and dangerous. Tell me a little bit about that. Who's at risk for this?
There are several risk factors for lung cancer. The very commonly known one is smoking, but also exposure to asbestos and radon, and even a family history can predispose you to getting lung cancer.
Yeah, because I think you said it well, that you think cigarettes and smoking, but there are so many diagnoses that it's not because of that.
Right.
And I think a lot of folks maybe aren't necessarily aware of that, and we can put some of those risk factors up on the screen. With many cancers, treatment, starting it early is so key, but I know with lung cancer, sometimes the diagnosis comes once that cancer is pretty well progressed. So talk about screening. What kind of screening is available?
So everybody's very well aware of prostate screening and colon cancer and breast cancer as well, but within the past 5 to 10 years, we've come up with lung cancer screening in high-risk patients. It's not for everybody, about age 55 to 80 with a significant smoking history, but it's highly recommended.
Now, encouraging, there are treatment options. Can you talk a little bit about those?
Sure. For early stage lung cancer, if it's identified before it's spread, surgery is the optimal treatment. Luckily nowadays, we can do most lung cancer surgery in a minimally invasive manner with either video assistance or robotics. In fact, at our institution at Penn State Hershey, over 90% of our lung cancer surgery is using minimally invasive.
Wow.
The advantage to that is get out of the hospital sooner, better quality of life, less pain. In fact, many of our patients are back to their activities, including going back to work within 2 weeks of surgery.
I've said before, I've said it on the show before, that lung cancer, it really scares me because I've learned so much about how that diagnosis can come, again, when the cancer is pretty well advanced. So it may scare other people out in the audience too, but they can talk more about you. I mean, we can only give so much information in this short segment. There's a web chat happening at 1 o'clock today. Both doctors are part of that. Again, it's a lung cancer web chat. You can ask us your questions. It starts at 1, it runs until 2, and you can visit abc27.com/chat in order to get more information and chat with the doctor. So good of you to do that. And I mean, it's like having a house call there at your computer. Good to have you. Have a great chat.
Thanks for having us.
We'll be right back with more Good Day PA.